Hey everybody, how's it going? Right now, we're still in the middle of the COVID-19 pandemic and it's scary and people have a lot of questions still out there. So today, I'm talking to Dr. Keyana Washington about what it's like for first responders dealing with the pandemic. We're also getting advice for parents on what they should do when they send their kids back to school in order to stay safe. We're also talking about masks and youth sports and whether or not kids should be wearing a mask while they're competing.
Awesome. Well, I'm Dr. Keyana Washington. I am a pediatrician in private practice in the Atlanta area. I am also a mom of two beautiful children, a 6.5-year-old son, because if you tell him he's just six, he will get very upset. So a 6.5-year-old son and a 3-year-old daughter. My husband and I, as I said, live in the Atlanta suburbs, and I've been in private practice for about 10 years. So I see kids from birth all the way up through age 20.
So you've been in practice for 10 years. Has there been any year like 2020 that you've seen in your career so far? And how has it been for you dealing with the COVID pandemic?
There has never been a year like 2020 in my career. And actually, some of the more senior partners in my practice who've been in practice for 30 years, 40 years, 45 years, they all say that there has never been a year quite like this. They did have some experience with the H1N1 influenza infection and pandemic that went on several years ago, but it was not nearly as widespread or scary as this has been. And that's the best term I can use to describe how it has been being a doctor during this pandemic. It's been scary. It's been surreal. I have many friends who are truly on the front lines in the emergency room, in the ICU, and are constantly exposed to this virus. And it's scary. When this first started, there was a lack of PPE. So we had that to worry about. How can we see patients and do what we've been called to do safely when we didn't have the appropriate equipment to protect ourselves? That has gotten a little better. It's not where it should be, but it has gotten a little better. But it's still scary. This is a scary virus. What scares me the most about it is that it's so unpredictable. You can have someone who gets it and has no symptoms at all, and then someone else who gets it and they die, and someone else who gets it who lives but has serious long-term consequences. And while there are some things that you can use to predict who will do poorly, of course, if you're elderly, if you have significant underlying medical conditions, you're more likely to do poorly, but there are plenty of completely healthy people who have succumbed to this virus in many ways. And that for me is what is so scary about it. You just never know what's going to happen if you catch the virus.
And I know with you saying being a wife and a mom and having to deal with COVID patients at your job, I mean, is it scary going home? Do you constantly think in your mind about that?
I worry about it every single day. I pray, Lord, protect me from this virus and protect me from bringing it home to my family. I mean, I just do not want to endanger them in any way, but this is my job. And even more than a job, this is my calling. Like, this is what I feel like I was put on this earth to do. So I can't give it up. And I can't do it from home. So I just try to be as safe as I can. My kids know when I come home that my 3-year-old would say, "Mommy, you have to go upstairs and wash off the germs." So she has learned not to come anywhere near me. She knows I go through my routine of taking everything off and dashing upstairs and getting clean, as she says, to try to protect them as much as possible.
So you're doing all of this and other first responders and health officials. Is it frustrating to see people out there who are like, I'm not wearing this mask, or people that are saying, you know what, I'm not going to stay at home, I'm going to the club tonight? Like, just to see those, like the people out there that aren't really taking it serious. Is it frustrating for you?
It's very frustrating. It's frustrating, it's confusing. There are a lot of emotions that go along with that. Because again, at the end of the day, it's not my calling to make your life miserable. It is not. I don't want to, tell you that you can't do this or you can't do that, but it's a sacrifice that we all have to make. I've seen some people liken it to, you're on a boat and you're rowing a boat and there's 100 people in the boat with oars, but you are the only one rowing. That is how it feels sometimes when you are making these sacrifices. You're seeing patients in person who are infected with this virus. For our first responders in the emergency room, you have people who come into the hospital very, very sick, critically ill, and they say, do everything you can to help me, do everything you can to help my family member. And of course, we will do that. We will do all that we can. But the question is still there. Did you do everything you could? I mean, some people are doing all that they can, but there are lots of people out there who are not being safe. And it is very frustrating when in the back of my mind, I feel like this didn't have to be this bad, particularly in this country, in the United States. It did not have to be like this. We could have done a better job.
I've seen so many social media posts where you've got somebody saying this virus is fake. It's essentially just the flu. And then a few posts later, you see, hey, everybody, can you please pray for me? I got COVID and it's not looking good. And then a couple of posts later, you see, hey, everybody, sorry to let you know, but Dan passed away. All of that seems like it just like if you just wear a mask and stay away from people. Is it hard beating that into people's heads? Like, look, this is serious. Do this.
It is hard. You have some people who are all about it, like right from the beginning, they've been in line with that. I think it was very confusing when the pandemic started because there was messages out there saying, don't wear a mask, reserve the mask for the healthcare workers. But I think it wasn't clear. It was saying, don't wear a mask because you should be at home and not exposing anyone. That's when everything was really shut down and we were all very limited in our movements. So masks weren't required nearly as much then because everyone was supposed to be at home, except the healthcare workers and essential workers who were wearing masks. But I think people kind of took that as, well, the masks don't protect us and it's infringing upon my rights, whatever the case may be. But you're right, there are people who have had to learn the hard way that masks really do help. And that you should wear it, not only for your own protection, but for the protection of people around you. And I tell, my patients when they come in and they're kind of halfway wearing their mask, I say, I need you to pull that mask up all the way over your nose and your mouth. And parents will be like, yes, she needs you to protect yourself. It's like, actually, no, your mask protects me. My mask protects you. So it's more about doing something good for the person sitting next to you or across from you or walking by you in the grocery store.
That's the most annoying thing that drives me crazy when I go to the grocery store and I see somebody have the mask under their nose or people that have it here and their mouth and nose are exposed. I'm like, dude, what's the purpose of even wearing it?
Why? And it's so interesting. Some people seem to have no insight into it. I had to run into the grocery store for one thing. I try my best not to go in, but I had to go in and I was walking up to check out and a guy was walking up from the opposite direction. We were going to the same checkout and he stopped. He was like, oh, you go ahead. You were here first. And I was like, no. And he said, no, I don't want to, cut in front of you. I said, you don't have on a mask. I don't want you standing behind me breathing. So I went to another line and he just looked like, oh, is this really a problem? Yes, sir, it is really a problem. I need you to put your mask on, please, all the way above your nose.
Because you also work with kids, there are a lot of states where the kids will be going back to school. Some districts here in Florida, like if the kids are failing, I've seen talk about the kids having to come back to school and things like that. What advice do you have for parents if they're in a situation where their kids can't do virtual anymore and they have to, maybe parents have to work, or a situation where they just have no choice but to put the kids back into school?
My advice is to do the best you can with the situation that you have. So I would recommend that the child wears a mask when they go to school, even if it's not required by the school. And I would recommend that you start practicing with your child now, wearing a mask for an hour a day, then increase it to 2 hours a day. Have them wear a mask at home. Have them watch you wear a mask. Don't say things about masks in front of your kids like masks aren't necessary or masks are annoying or we shouldn't have to wear them, because your children will listen to that and you are their best example. And that's what they will want to do when they go to school. So the best thing we can do to protect our children when they're sending them back to school in person is to have them wear a mask the entire time. Teach them how to clean and sanitize their hands, and even talk to them, especially the older kids, about trying to maintain 6 feet of distance from other people.
That's kind of tough when you're talking to kids, 6, 7 year olds, like
Oh
stay
yeah,
away from your friend.
yes, they don't do social distancing at all. I'm talking about middle schoolers and high schoolers. They can social distance, they may not want to, but it is possible for them to just try to put a little extra space between them and their classmates. But for kids in elementary school, you just put that mask on them, send them to school with some hand sanitizer, and pray for the best. Now, when they come home, I would recommend going ahead and having masks that they have at school. Maybe they're washable, and then something different that they would wear at home, so that they aren't bringing those school germs into the home. Have them change their shoes as soon as they get home before they come in, and then even go ahead and change their clothes, wash their face, wash their hands as soon as they get into the house.
Another thing that's a lot of parents are dealing with is youth sports. What to do about kids playing sports. My wife and I went back and forth for a while to decide on whether or not to allow my kids to continue to do sports and dance. One of the things is that these kids have been stuck in the house, many of them since the spring. So getting them out to do some activity is something that you want, but you want it to be safe. What are your recommendations for kids doing sports during this pandemic?
So I recognize that children need an outlet, and sports is a wonderful way for them to have that outlet. And so I do think that things can be done in a safe manner. It will not be without risk. There will always be risk. I mean, you hear about even professional sports teams that are still having difficulty controlling COVID among their players and coaches. So, of course, you will have those same issues with youth sports teams. But there are things that can be done. I prefer outside sports over inside sports just because of the circulation of air and the ability to get fresh air. I prefer limiting the number of spectators at the sport in order to decrease the number of people who would possibly be exposed or who could be bringing COVID into the sports area. I think that coaches should wear masks all the time. They are not actually out there running up and down the field or up and down the court. So coaches, assistants, people on the sidelines, any spectators should be required to wear masks the entire time. Players should be required to wear a mask when they are not actively playing. I don't necessarily recommend wearing a mask when you're actively playing soccer or football or anything like that. But when you're sitting on the sidelines watching your teammates and cheering them on, definitely should be wearing masks.
I definitely appreciate you talking to me. Tell me how people can find you. I know you have a blog as well. Shout out
Yeah,
your
I have
website.
a I have a blog, mommydoctorkisses.com. So that's where I write about my experiences as a mother, as a wife, as a doctor, and sometimes it all mashes up together. So you can catch me there and learn about the things that are going on in my life. I talk some about COVID. I talk some about social injustice in our country. I talk some about potty training and recipes. So it's just kind of a mishmash of a bunch of different things. So mommydoctorkisses.com. That's where you can find me.
I appreciate it so much. Thank you. Thank
All
you.
right.
Dr. Washington and I had so much more to talk about that I'm going to have to create a part 2 to this interview so that we can make sure we get all of that information in. We're talking about Thanksgiving as well as vaccinations and whether you and your family should be the first in line to get the vaccine when they start to give them out. I appreciate you watching so much. And make sure, though, after you finish watching this video, to hit subscribe so that you can subscribe to my channel, so that you can make sure that you don't miss out on any of the content that I'm putting out there. Again, thank you so much for watching, and we'll see you next time.